Morning. My name is Melissa P. Dunn. I am the CEO of MD Marketing Network. I'm also a Live Healthy Miami Gardens Communications Sub-Council member. Welcome to the Live Healthy Miami Gardens press conference on the National Influenza Vaccination Week, which is an initiative funded in part by the CDC in collaboration with not only Live Healthy Miami Gardens and the City of Miami Gardens, but several providers, including CFCE, Jesse Trice Community Health Systems, and UHI Community Care Clinics. I am going to go ahead and get started right now, but just some quick housekeeping. If we could just go through very quickly and do an introduction so that everybody knows who's on the call. We'll start with you, Dr. Jaffer. If you could, let me just unmute you very quick. Well, if you could just unmute yourself for 2 seconds and tell us your name and your organization, sir.
Hi, this is Dr. Mohsin Jaffer. I'm a board member of the UHI Free Community Care Clinic. We've been around for 12 years, and later when I get a chance, I'll tell you a little bit more about ourselves. But we are very much into preventive care and immunizations, and I'm very glad that you have this initiative.
All right, thank you, sir. All right, Dr. Kirwan, if you would just 10 seconds, who you are and what organization you represent.
Good morning, everybody. My name is Dr. Kirwan, Michelle Kirwan. I'm the Chief Medical Officer and Pediatrician here at the Center for Family and Child Enrichment.
Hey, Dr. Jackson.
Good morning, everyone. My name is Dr. Theresa Jackson, Family Nurse Practitioner here at Jesse Trice.
Thank you, Dr. Jackson. Ms. Labrouse.
Good morning, everyone. My name is Thamara Labrouse, and I am the Program Director for Live Healthy Miami Gardens for the City of Miami Gardens.
Councilwoman Wilson.
Hello, everyone. I am Katrina Wilson, Councilwoman for C4 here in the City of Miami Gardens, and a lifelong educator in Miami-Dade County Public Schools.
Thank you, Councilwoman. Dr. Blackmore.
Good morning, everybody. I am Dr. Carina Blackmore. I'm with the Florida Department of Health, and I'm glad to be here.
Thank you, Dr. Blackmore. Dr. Collier.
Good morning, everyone. This is Dr. MJ Collier. I am the radio medical consultant for Radio 1, and I'm also in private practice in Atlanta. My practice is Atlanta West Primary Care.
Thank you, sir. All right. Nancy.
Yes, hi, I'm Nancy Ancrum. I am the editorial page editor of the Miami Herald.
Thank you, Nancy. All right. All right, Mr. Vargas. Okay, well, we will go ahead and get started. So our first speaker today is Councilwoman Katrina Wilson. Councilwoman Wilson is a native of Miami-Dade County. She's also a graduate of Miami Carroll City Senior High. She received her bachelor's degree in public administration and has a master's degree in reading K through 12 from Florida Memorial University. Councilwoman Wilson is a veteran educator and achiever with more than 30 years of service to Miami-Dade County Public Schools. She is a transformer of ideas, concepts, and vision through public, private, and governmental partnerships. She has worked on major projects both at the local, state, and national levels to bring into existence innovative ideas to help educational and community-related projects move forward and progress towards reaching their truest potential. So Councilwoman Wilson, if you'll give us a welcome, please.
Okay, welcome. It is my pleasure to be here today. As indicated, my life experience has been about being involved in projects just like Live Healthy Miami Gardens. One of the things that we know is that health is the new wealth. And because we know that, we recognize how important it is to educate the community, to equip them with the tools to make solid and strong decisions. The thing that I love about Live Healthy Miami Gardens is that it doesn't just start with the adults. It reaches out to the youth. Its programming really seeks to establish behaviors and practices and values in our community that helps us to solidify a foundation of long life and long health and strong choices. The city of Miami Gardens is extremely proud of how our community has handled and responded to the pandemic. It has put us in a position where our health and our choices have been clearly aligned as we have sought to mitigate the impact that the pandemic has had on us. And so as a community, as we look forward to how we are going to address this as an issue in our community, is to really encourage our residents to take a look at getting the flu vaccine. We understand that many times we have a lot of underlying conditions that make us greater or even more susceptible to the coronavirus. But the flu vaccine can help us to preempt other kinds of illnesses that can be caused in flu season and by contracting the flu. So if our residents will get involved and really take advantage of the opportunities that are out there to get a flu vaccine, we are really encouraging them to do so. And if their past behavior has been an indication, we will get the response from them that they have given us through the pandemic. They will become wholly and compliantly involved in trying to do and make the best decisions for themselves, for their family, and subsequently for us as a community. We know the importance that education plays. I've been a lifelong educator, and I am of the opinion that when people know better, they do better. And when they do better, their behavior not only impacts them, but it impacts everyone that they touch, everyone in their household, everyone in their workplace. And so this whole thing gains momentum as we move forward. We want to keep Miami Gardens healthy, not only healthy physically, we want to keep them healthy mentally, and we want to keep them healthy, you know, in their money. So when you're not sick and you can go to work and you can be productive, then life is better for everyone in our city as well as everyone in their home. So I'm excited about what Live Healthy Miami is doing with the CDC. I'm excited about the work that we have ahead of us for the next few weeks as we emphasize this time in our year that the flu is something that we deal with every year, but we've got to be diligent about how we bring it to the forefront this year so that we can make sure that our families and the next year have a solid year being laid in terms of a strong foundation.
Thank you, Councilwoman.
My pleasure.
So next, we're going to hear from Thamara Labrouse, who is the Program Director of Live Healthy Miami Gardens. She's going to share with us not only some information about Live Healthy Miami Gardens, but specifically about this initiative, National Influenza Vaccination Week, that we are celebrating starting on Sunday. Thamara Labrouse is the Program Director for Live Healthy Miami Gardens. She has led this initiative since its inception in July of 2014. Ms. Labrouse has over 25 years of management experience in social, human services, and governmental settings. She specializes in cultivating partnerships that bring grassroots leaders together with professionals and policymakers to improve communities. Ms. Labrouse.
Thank you so much, Melissa. And thank you, everyone, for joining us. Once again, my name is Thamara Labrouse, and I have the great honor of working for the beautiful city of Miami Gardens as the Program Director for Live Healthy Miami Gardens. So Live Healthy Miami Gardens was started in 2014 as a collective impact initiative, wanting to look at health disparities within the city of Miami Gardens and among the 113,000 residents that reside within the city of Miami Gardens. We started Live Healthy Miami Gardens because we recognize that a lot of what has to do with good health does have to do with individuals' choices, but also the communities where we live, where we work, where we play, and where we learn are major factors impacting our ability to make healthy choices. And so we wanted to be able to provide resources and information and make it easy for our residents to be able to make the healthiest choices possible. We focus on 5 health impact areas: alcohol, tobacco, and other drugs, physical activity, healthy eating and nutrition, mental health, and primary health care. I mentioned just a few minutes ago that we are a collective impact initiative. And what that really means is that our work is not possible as just the city. It's through the collaboration of so many organizations and so many individuals that we've been able to do this work and have the impact that we want to have in terms of improving health outcomes in Miami Gardens. We're supported by our city manager's office, by Councilwoman Wilson and the rest of our city council and our new mayor, but we're also supported by over 66 different organizations and 105 individuals within the community. These three organizations that are joining us today, CSCE, UHI, and Jesse Trice, are just three of the examples of the strong collaborations and partnerships that we have put in place in order to make sure that our residents and other stakeholders have access to everything that they need in order to be healthy. We're excited about this new work. Today is the official kickoff of our vaccination project funded through the CDC. The CDC is partnering with a number of organizations across the country to do this collectively so that there is some momentum built around this. Councilwoman mentioned the co-circulation between the flu and the vaccine, and because of that, this year, we think this work is particularly important, and the goal overall of this project is to really get as many people vaccinated as possible. We want to get the information out there. We want to talk about what is the correlation between the vaccine and the flu. We want the flu and COVID-19. We want to make it really easy for people to be able to get free vaccines. We want them to be able to make a choice, not just for themselves, but for their families. So our partners will be offering free vaccines across the community between now and September of next year. So there's plenty of opportunity and plenty locations where our community can get vaccines. We're also working to educate our community so that folks understand, and we're addressing some of the myths associated with the vaccine. I think our providers will talk a little bit about that as they're the clinical experts, but we really want to be able to educate our community and have them make an educated and informed choice for themselves and their family. I love when Councilwoman mentioned that when people do better, they know better, they do better, and that is really the premise of this whole campaign. So we're excited to kick this off. We've got a number of things going on from Sunday of on the 6th all the way through the 12th, and we've got churches that are involved, we've got employers within the city that are involved. We're offering the flu shots across a number of different locations in Miami Gardens. We're also doing some educational components, mostly on Facebook. Much of it will be very virtual, again, to educate our community and to get the information out there so that they can make an informed choice. We're working with our seniors. Obviously, our senior population is a vulnerable population, but really anyone over 6 months old can get a flu vaccine, so we're encouraging that for our full community. So we're excited about what we're calling the Sleeve Up campaign. This is the national campaign that the CDC is doing, and we're just mirroring that campaign at the local level. And the Sleeve Up campaign is just a movement to get as many people involved in putting the message out there that it is really important to get a flu vaccine because it is the most important way to protect yourself and your family.
Thank you so much, Thamara. So details about all of the events that's happening this week can be found on the Live Healthy Miami Gardens website, which is livehealthymimigardens.com. As Thamara mentioned, on Sunday, the 6th, we will be doing a faith-based virtual kickoff with 6 churches: Antioch Missionary Baptist Church, Holy Family Episcopal Church, Mount Zion AME Church, Mount Hermon AME Miami Gardens, St. Stephen's AME Church, the Islamic Center of Greater Miami. And then on Monday, the 7th, they'll be the community can go to Jesse Trice Community Health System for a free flu shot. Then on Tuesday, we'll be interviewing an expert from the local health department on Facebook Live. On Wednesdays, residents may go to CFCE for a flu shot. And then on Thursday, we'll have 2 activities. At 10 a.m., we'll be having a senior citizens vaccination info session and drive-through flu vaccine drive. And then at 2 o'clock, we'll have a wellness webinar for a lunch and learn type activity where we're going to be talking about dispelling the myth of the flu vaccine. Then on Friday, they may go to UHI Community Care Clinic. And then, of course, on Saturday, we'll round up with some social media messaging around our Sleeve Up campaign. So that's what we have planned for National Influenza Vaccination Week. Now, I'd like to introduce one of our key speakers for this press conference. Dr. Blackmore is the director of the Florida Department of Health Division of Disease Control and Health Promotion. She provides oversight for the Bureau of Epidemiology, Community Diseases, Environmental Health, and Public Health Laboratories. Dr. Blackmore also serves as the state of Florida's epidemiologist. Dr. Blackmore.
Thank you very much for the introduction. I'm delighted to participate in this press conference. Flu vaccines are so important. And so that's what I'm going to talk about, why it is important to get your flu shot. Flu is a contagious respiratory illness caused by flu viruses that infect the nose, throat, and sometimes the lungs. And common symptoms include fever, cough, sore throat, runny and stuffy nose, muscle and body aches, headaches, and tiredness. The symptoms can be mild or more severe and at times lead to death. Flu is spread by tiny droplets that can land in your mouth or nose or your eyes. And it is also possible to get the flu by, sometimes not as important, but possible to get the flu by touching different types of surfaces or objects that have flu viruses on them, and then touching your own mouth, nose, or eyes. So why then is it so important to get the flu vaccine? Flu is very common and spreads very easily from person to person. While most people recover from flu within a few days to a couple of weeks, some can develop complications such as pneumonia or sinus and ear infections. More uncommon complications include heart, brain, or muscle tissue inflammation. The flu makes chronic health problems worse, such as asthma or heart disease. So by getting the flu shot can help both you from getting sick and from spreading it to others at the same time. The flu shot also reduces the risk of complications in vaccinated people who do get sick. But, and it's less likely that vaccinated people who get sick end up in the hospital. Flu shots prevent tens of thousands of hospitalizations and deaths in the United States every year. So who then should get vaccinated? As was mentioned earlier, everyone 6 months or older should get a flu shot every year. It's especially important for those who are 50 years or older, children between 6 months and 4 years. Those problems such as lung disease, heart disease, kidney disease, liver disease, and diabetes. People who have weak immune systems for various reasons, because of medical treatment such as cancer or transplants, but also those with diseases that cause immune deficiency like HIV. Women who are pregnant or will be pregnant during the flu season should get the vaccine. And they should also get the vaccine, if they haven't, immediately after birth, because that may help both them and their newborn baby. Children with chronic health issues, including those who are receiving aspirin-containing medications, that makes flu disease a very serious issue. Residents of nursing homes and other long-term care facilities. Minorities, American Indians, and Alaska Natives, and other racial and ethnic minority groups are more likely to get severe complications from flu and definitely should get vaccinated. People who are obese, those with a body mass index 40 or greater. Healthcare personnel, and household contacts and caregivers of young children under 5 years of age, and caregivers of adults over 50, and household contacts of anyone that have a chronic health issue. So if you're close contact of someone with a severe health issue, you need to get vaccinated. The flu season starts in October each year. And if you have not received your flu shot yet this year, this is really time. And it's great to see all the activities this week associated with the National Influenza Vaccination Week in the Miami Garden area this week. A very great opportunity to get vaccinated against flu. There's not a specific deadline for getting the flu shot, but it takes about 2 weeks for the flu shot to take effect. So the earlier during the season you get the flu shot, the better it protects you from getting the flu. Adults, as was mentioned, will need 1 shot each year, and young children between 6 months and 8 years who've never been vaccinated before, who have only received 1 dose of vaccine in previous years, they need 2 doses 4 weeks apart. So flu vaccines on the market, more than 10 types, and different flu shots are approved for people of different ages. Most require a shot in the arm. 1 type that's available is administered using a nasal spray. Some flu shots are specifically designed for older populations and for people that have egg allergies. And the nasal spray vaccine is recommended for healthy adults or healthy people between 2 and 49 years of age who are not pregnant. So it's really important to discuss with your doctor which vaccine is best for you. Flu vaccines, in addition to the events this week during the National Immunization Week, vaccines are available in a number of places, a variety of healthcare clinics, pharmacies, and as well as the health department. So if you do not take part in this week's activities, I recommend you call ahead to the health clinic of your choice to make sure that they have the vaccine that you need. I hear periodically, including for my own father, that you can get flu from the flu shot. That is not, you cannot get flu from the flu shot. But there are many types of flu germs circulating every year, and the flu vaccine is made to protect against the 3 to 4 most common viruses out in the community. In addition to that, the decision of what type of flu germs to put in the vaccine has to be made a few months before the flu season to make the vaccine. So sometimes there are flu strains circulating that are actually not part of the vaccine. Like any medical product, the flu vaccine does have some side effects. People may get some soreness, redness, and swelling around the area of the shot. They can also get headaches, fever, nausea, and muscle ache. These are generally mild side effects for most people and go away on their own within a few days. In other words, flu vaccines are safe and they save lives. So in summary, make sure to protect yourself and your loved one by getting a flu shot. Stay away from people who are sick and make sure that you stay away from other people when you're sick. Wash your hands and make sure to get a flu shot. Thank you very much for your attention.
Thank you so much, Dr. Blackmore. Our next speaker is Dr. Millard Collier. He is a family physician in Georgia, and he offers primary care for the entire family, from seniors to children. He's nationally known as the hip hop doctor who offers weekly commentary on the nationally syndicated Rick Smiley morning show. Dr. Collier.
Thank you so very much for allowing me to participate. It is a pleasure to be here to emphasize the need for influenza vaccination, because we are now in the middle of a twindemic, i.e. we have the coronavirus, the COVID-19, as well as the influenza vaccine, of the influenza infections that are available now in the community. And the worst case scenario would be for a person to simultaneously capture both disease states. Now, the great thing about the influenza is this: we do have a vaccine for it. We've been eagerly and anxiously awaiting the coronavirus vaccine, and it's being accepted with enthusiasm. But what people seem to have gotten a little fatigued about is their flu vaccine. Everyone has a dramatic story from a friend of a friend that says, oh, well, my cousin took the flu shot and they got sick, and you know, or I took it and you know, and I'm never going to take it again, or I've never taken it and I've never gotten sick, so I'm just going to take my chances. So it's very important to emphasize to the community, and that's why I was really glad to hear about the faith-based initiative, because reaching the community in an effective way, going through the churches, is the most effective, bar none. Again, it's a safe environment for people. People are ready, willing, and able to hear the information that you're sharing with them. And if you bring free injections at the same time versus just the information, you're really going to have an effective campaign going. So I'm telling people now that it's very important to get your flu vaccine, everybody age 6 months and older, unless there's some reason not to get it. For people that do have egg allergies, because the majority of flu vaccines are created and grown inside of an egg. And so if an egg, if a person has egg allergies, there are cell-based therapies that are egg-free, and that they relieve people of that possible allergic response. So that will make them be able to tolerate the vaccine. Now, everybody says, and I want to make this clear, there's nothing that is disease causing in the influenza vaccine. The influenza vaccine cannot give you the flu. So if you happen to catch it, it's because you were immunized later, you were already exposed before immunity was available. Because when you get the injection, at minimum, it will be at least 2 weeks before you have effective immunity. It may be up to 4 weeks. And this is for people with normal functioning immune systems. If you're immune compromised or you have comorbid conditions that challenge your immunity, such as high blood pressure, diabetes, or even more importantly now, obesity, we're finding out is a very substantive and significant comorbid condition, then it may take even longer for your body to develop immunity. But if you have a normally functioning immune system, you should develop immunity, and that is literally your best shot at protecting yourself over the next few months. The flu season technically is from October to May, so we are just really starting to get toward the really bad portion of it. The weather is changing across the country. People are more indoors now, ergo more susceptible to infection. One of the great things also is that the indications for coronavirus protection, social distancing, wearing a mask, and washing your hand also are very effective preventions for the influenza infection as well. So if we could get people to embrace those things, the 3 W's, washing hands, watching your distance, and wearing a mask, then that will also help have a very positive impact on this season's influenza. Now, I want to make it clear that the influenza vaccine, just as Dr. Blackmore stated, has to be created months before the actual flu season. And oftentimes we can get a heads up because the flu starts in other parts of the world before it comes to the United States proper. Most of the time, it's a reasonably decent match with the flu that's out there in the community, and we get anywhere from 50 to 60% protection from the influenza vaccination. Every once in a while, it's a poor match. I think 1 or 2 years ago, we had about a 20% match, which was not that good, you know, and those odds are, you know, really no more high than catching it in the community. But I think we have a reasonably decent match with this year's influenza vaccines. There are multiple versions available from various companies. Again, the egg-based, the cell-based, and even an attenuated flu mist that's given nasally for people that are injection phobic or just don't want to have shots. But it's really, really not unpleasant to obtain a flu shot. Now, again, Dr. Blackmore was very elegant in describing some of the side effects. One of the things that I have learned in my many years of clinical practice is that it's important to prep the person for an influenza vaccine. So I tell the patient to take over-the-counter preparations such as Motrin, Advil, Aleve. These are all anti-inflammatories, even aspirin or Tylenol, with Tylenol being for pain, but it's not an anti-inflammatory. Take that before the shot. Take it the evening after taking the shot, and take it the morning after. That will decrease tenderness and soreness in your arm. It will decrease body aches. It will decrease some of the potential side effects that you could have from the flu shot. And so when I provide flu vaccinations, I have a box of those medications available for patients. And if they are no contraindications, such as the patient on blood thinners, then I will dose them before giving them the shot and give them 2 additional doses. Again, 1 to take at home that evening, 1 to take the next morning. These are just one of the clinical pearls that I've learned. If a person does not have a bad response to an influenza injection, then they are not shy about obtaining it the next season. But if it makes their arm sore and they have a lot of body aches and they feel sick after they've gotten it, they're not going to have a lot of enthusiasm for getting it the next time. Now, and those, even in the individuals in which that happens, it's a rare and unusual occurrence. Most people get it without any problems. But just to make sure that people have a positive impact, I try to minimize the potential side effects by doing that. Again, the key talking point here is that the influenza vaccine does not make you ill. So you don't have to worry about that. That is, it's not a myth. In the past, the influenza vaccine was a milder version of the flu. And the objective was to give you a case of the flu that most people would get over with no problems, but some people did have bad cases. And during that time, it was very difficult to endorse and enthusiastically give flu shots because they would oftentimes make people sick. But the current technology, that is not an issue. That is not a concern. None of the preservatives in the flu vaccine can cause you any problems. So there's no problems that some of the mythology and the things that are on social media in reference to vaccinations talk about some of the side effects from preservatives. That is not an issue with the flu vaccine. So the flu vaccine is available. It's readily available in most places. I'm so glad to hear in the Miami Gardens area that you are providing a lot of free vaccines. But for most people, if you have Medicare, Medicaid, if you have any health insurance, it's going to be covered because of a mandate for immunizations under the Affordable Care Act. So you should be able to get it at no cost. But if you, for whatever reason, cannot find a free vaccine and you have to get it and pay for it, it's $25 or $35. Now, that is the absolute best investment that you can make in your health for the next, for this current flu season that we're in and for the coronavirus pandemic. Now, at this time, people have a variety of different infectious disease states. So you have allergies, and allergies are impacting a lot of people now, more so than ever in my medical practice. I have no idea why. I don't know what's going on in the environment, why people are more sensitized at this point, but they're having allergy symptoms. It's also, because of changing the weather, the common cold season. So people are having allergies. They're having common colds. They're also now getting and being exposed to the coronavirus, COVID-19, and they're susceptible to influenza types A and B. So it's important to look at some of the potential differences in those disease states because a lot of the common symptoms are across the board. But one of the differentiations between common cold and allergies versus the coronavirus and the flu is fever. It's highly unusual to have fever with the common cold or with allergies, but with the coronavirus, it's very common, and with the influenza, it's very common. It's one of those key denominators that will allow you to determine that disease state based on your symptoms. So before you go to Dr. Google, follow up with your health professional, have someone evaluate your signs and symptoms, and don't come in with a preconceived diagnosis based on what you have read, because the information that you capture when you go to the internet for a health diagnosis is directly proportional to the signs and symptoms that you put in. And it leads you down a pathway based on how you answer certain questions. And a health professional can easily determine that, oh, no, that's not correct. But the algorithm that they have on Dr. Google or WebMD or a variety of other resources that they have is that, you can lead yourself down a primrose path. And now you got to spend 30 minutes as a healthcare provider debunking what the person already thinks they have, and they want you to give a second opinion on. They just want affirmation and confirmation that they have self-diagnosed, and that's often not the case. So coughing is very common amongst all 4 disease states: allergies, the common cold, the coronavirus, and the flu. Sore throats, very common with the flu as well as with the coronavirus. One of the initial symptoms is sore throat with that, and it's more so than the usual just discomfort in the throat. It usually is a bit more aggressive when doing so. Shortness of breath with the coronavirus as well as with the flu. Not so common with allergies, not so common with the common cold. Fatigue, Depending upon your health condition, your comorbid conditions, all of them can make you feel tired. So that is not necessarily a clear differentiation, because when you're sick, you usually have some fatigue. A key, and this was initially not really appreciated by the medical community, but anecdotally, patients were telling them, I have lost my sense of taste and I have lost my sense of smell. And doctors were really, including myself, saying, well, I'm not sure whether it has any substantive significance, but we found out that is a key symptom and very, very prominent with the coronavirus. It can happen with allergies. It rarely happens with the flu, and it never happens with the common cold. But if you have bad allergies and you just got a lot of nasal congestion, you can usually have some impairment of your sense of smell, but your sense of taste is usually intact. So those are key differentials. Body aches and pains with the coronavirus as well as with the flu. Not so common with the common cold, rarely happens, if at all, with allergies. Headaches, common also, because particularly if you have the problems with the loss of smell, the coronavirus can go down the olfactory nerve and impact the meninges of the brain as well as the brain tissue proper and give you headaches as a sign and symptom. Okay, runny or stuffy nose, very common with allergies and the common cold, not so common with the influenza as well as the corona. GI symptoms, common with the flu, but also one of the problems with the coronavirus. You may not have a lot of respiratory symptoms at all, but because the coronavirus can also infect the lining of the GI tract, you can have nausea, vomiting, diarrhea, other GI symptoms. So those are some of the things you need to be aware of. The key thing is the coronavirus vaccine is still not approved. It is seeking emergency approval from the FDA in real time right now, but none has been given the go-ahead. We expect that any day now from the Pfizer vaccine as well as the Moderna vaccine. So that may happen before this meeting is over, but it has yet to happen. But we have now, please embrace influenza vaccines. If you're an older individual, you may need the higher dose. If you are compromised in some way, you may need the high dose vaccine to ensure that you have good immunity after you receive the vaccination. But it is also key that you get the flu shot 6 months or older. If there's no contraindications, if you are pregnant, if you're thinking about becoming pregnant. They used to not recommend that pregnant women get the flu vaccine. Now they do. So virtually no disease state puts you out of an option for taking a flu shot. So we want to make sure that everybody does. It's readily available. Go get it today. Don't think about it. Don't plan to get it this weekend. Get it today. Get it as quickly as possible. And understand it will not make you ill, but it will provide you with your immune system will be boosted for the entire remainder of the flu season as well as the coronavirus, but you will be protected from the flu. And having had a flu immunization, then they can concentrate on other potential disease states such as the coronavirus if you develop a respiratory tract infection.
Thank you so much, Dr. Collier. I appreciate the information. That bit about Dr. Google is quite funny.
Yeah, I have to face him every day.
Dr. Michelle Kirwan is the Chief Medical Officer and Pediatrician for the Center for Family and Child Enrichment, and she is one of the key partners in this project. Dr. Kirwan, could you share some information about not only your organization, but the resource that you're providing as it relates to the CDC National Influenza Vaccination Project?
Absolutely. Good morning, everybody. My name is Dr. Kirwan. I am the Chief Medical Officer here at CFCE, also doing business as the Pediatric and Family Health and Wellness Center. We have been serving the Miami Gardens community for over 40 years, and 7 of those years we have been a federally qualified health center. As such, we offer pediatric care to our children. We offer family practice for adults. We offer dental services for both children and adults. And we have a registered dietitian offering nutrition services. We also have a nurse home visiting program. It's a free program for first-time pregnant moms. And we have a very robust behavioral health department with psychologists, psychiatrists, social workers, and therapists. And we offer a variety of mental health services, including psychological evaluations, individual, family, and group therapy, medication management, anger management, domestic violence services, parenting programs, substance abuse, and many more, anger management, I think I mentioned, many more programs as well. We accept a variety of insurance. We are open 6 days a week. We have, going back to insurance, we have an outreach and enrollment department that can help you enroll in the Affordable Care Act or other insurance. We also offer a sliding fee program for those who are uninsured based on household income and household size. And we have been a partner of the Live Healthy Miami Gardens initiative for many years, and we are excited to continue that collaboration in this campaign for flu vaccine and distribution of flu vaccine. So we are offering it to all of our families, all of our patients and their families, all of our employees, all of our foster children, as we're also a foster care agency. We are offering drive-up vaccines for those who don't want to get out of their car in this time of COVID. We are offering walk-in vaccines, as mentioned earlier, next Wednesday, and we do intend to continue having a weekly walk-in day to offer to the community. We will be going out into the community in conjunction with Live Healthy Miami Gardens to offer the vaccine. So if there's anyone out there that is interested in having us come and do a flu vaccine fair with them, we are open to that as well, collaborating with you with that. And we will also be offering a variety of education from pamphlets to Facebook Live, Zoom meetings, Lunch and Learn, and information on all of our social media. So we thank you for the opportunity, and we're here to help vaccinate all of you for the flu.
Thank you so much, Dr. Kirwan. So on Monday, December 7th, from 10 a.m. to 7 p.m., free flu shots will be available at Jesse Trice Community Health Center, located at 4692 Northwest 183rd Street, Miami Gardens. Phone number 305-623-0993. Additional information on how to access the flu shot from that location can be found on livehealthymimigardens.com. Next, we have Dr. Jaffer, who is with UHI Community Care Clinic. Hi, Dr. Jaffer.
Hi, folks. UHI Clinic is a love affair with Miami Gardens City. We found that we wanted to do something. Most of our board members were dedicated, we gave a lot of money from their pockets and their time, felt that healthcare was the most important factor. The greatest blessing in life is health, besides all the other blessings. And we felt that Miami Gardens was not well served. So we opened a clinic there, and we give pediatric immunizations, primary care, psych care, specialty care. And we have got partners now lately. FIU brings their medical students and nurse practitioner students. With St. Nicholas, we have a dedicated pediatrician who comes. And with University of Miami, we have a smoking cessation program. And I want to compliment your city for having this Living Healthy program. I personally was born and brought up in Africa, Kenya, and I've seen the devastation where not enough healthcare, it stunts the population, mentally, physically, and all around. And healthcare is one of the most vital services a country can provide. And I'm sorry that we do not provide enough in our nation for the not completely indigent, but the working poor. And we found a lot of them in Miami Gardens. And that's why we opened this clinic over the last 12 years. Before COVID, we were seeing 30, 40 patients a day. And it's completely free. And it's devoid of who it is. Anybody can walk in our clinic and can say it doesn't have the money. We take care of them free. And this program of Living Healthy is a very, very vital program. All resources should be dedicated to this, and I compliment the city leaders for doing this. And influenza, I want to, Dr. Blackmore and Dr. Collier said some important things, but I want to drive one point home. 25 to 30 million Americans die every year, and millions are disabled or debilitated or hospitalized. And this is despite the fact that we have vaccination and we have treatment, and yet we have this devastation. So flu vaccine is absolutely necessary, and we're giving it free. Remember, our number is 305 number 620-7797. And we provide all sorts of care, and call us. We can even get specialty care. And this is a labor of love that has really given us a lot of satisfaction. of doing something good. And we have a city that partners with us very well. God bless you all.
Thank you so much, Doctor. So UHI on Friday, the 11th, will be offering the free flu shot located at 4745 Northwest 183rd Street, Miami Gardens. Phone number 305-620-7797. Next, we have Dr. Theresa Jackson.
Hello, good morning, everyone. My name is Dr. Theresa Jackson. I'm a family nurse practitioner, board certified, and been with Jesse Trice for 7 years now. Today, I would like to speak with you in reference of the flu vaccine. Last year at Jesse Trice Community Health Center, we offered over 5,000 flu vaccines. And this year, we're aiming to give more vaccines in the spite of the COVID-19. We offer mental health services here at Jesse Trice Community Health Center, along with pediatric, podiatry, dental, OBGYN, family planning, and nutrition, and we also do HIV management. We offer the high dose vaccine for our elderly population and also the patients that have allergies to the flu vaccine. We can offer the flu block. We also have sliding scale for those that are uninsured. You do not necessarily have to have insurance to be seen here at Jesse Trice. So we see everyone. We encourage everyone to get their flu vaccine. It's very imperative due to the COVID-19 and the different things that's going on in the community right now. The flu vaccine is free for uninsured patients, and all insurances cover the flu vaccine. According to the CDC, the 2019 to 20 flu season led to 18 million medical visits and 24,000 deaths and 410 hospitalizations. So it's very, very important for everyone to get their flu shot. Here at Jesse Trice, we offer everyone, all of our patients, with the flu vaccine, and especially for those that have respiratory complications, respiratory disease, diabetics. They are very liable to get different type of complications due to the flu vaccine. So we are recommending that they are the ones that get it. Everyone should get it. Everyone should be wearing their masks and washing their hands and taking good care of themselves. We also will be offering the flu vaccine at Jesse Trice Miami Gardens on December the 7th that was mentioned. We're giving the flu vaccine free of charge. Anyone can come in. The hours are from 10 to 7 p.m. And Miami Gardens area, the address is 4692 Northwest 183rd Street in Miami Gardens. We also here at Miami Gardens will be giving the flu vaccine, and also at our main campus, we will be giving.
Okay, looks like we have a little audio challenge. Thank you so much, Dr. Jackson. Now we're going to go to the question and answer period of the press conference and invite the press to ask any questions. You can do so by raising your hand, and then I will call on you and unmute you. Hello? What happened?
Did you get kicked out? Got kicked out. Okay, it's reconnecting. Okay, we're back in.
Okay, sorry about that, folks. We had a little bit of technical difficulties. Can you hear me?
Yes.
Yes? Okay. All right. So now we are going to go to the question, and thank you so much, Dr. Jackson. We're going to go now to the Q&A section of the press conference. So if any member of the media that's on has a question, I see that everybody is still trying to come on. If you could just raise your hand, and I will acknowledge you. Wait, Natasha, could you make me co-host again, please, so I can see the participants?
Nancy's raising her hand. Nancy from the Herald.
Yeah, I can't see it because I'm not.
Have Natasha do it.
Yeah, Natasha, yes, Nancy, go ahead with your question.
Yes. Well, there sometimes, some years, there has been a question of availability. This year, this flu season, are the supplies of the flu vaccine plentiful enough for everyone who wants it?
Dr. Blackmore, can you answer that question?
Yes, there are no concerns with supplies of the flu vaccines this year. There is a finite supply that is produced for a season. So late in the season, sometimes providers run out, but right now there's plenty of vaccine.
And when specifically does flu season run from it? We're already in flu season. When does it end?
So technically, it actually ends in May.
Okay.
Peak months are in the winter months, November, December, January, February.
Right. Thank you. Thank you. And I suspect all of the doctors, I suspect everyone here addressed it, but I'd like to just hear specifically whether having the flu has any implications for making you more vulnerable to catching the coronavirus or vice versa?
I'd be happy to address that. This is Dr. MJ Collier. There was a recent study that confirmed that having had an influenza infection does not predispose you to coronavirus, does not make your potential to capture the coronavirus any more than if you had not had the influenza. So it does not cause that issue. The problem is if you are simultaneously infected with both, then your body's immune system will probably be overwhelmed and you have a much more significant case of both the flu virus, and because your body will be trying to fight on two fronts. So, that was a question that was asked, and everybody, the assumption would be that if you had either the coronavirus or the flu, that you'd be more susceptible to the other. But there doesn't seem to be any long-term damage that would predispose you to a respiratory tract infection with either if you've had the other one previously.
Thank you.
You're welcome.
Is there any indication that the flu vaccine and the upcoming coronavirus vaccines will, for lack of a better term, be at odds at all, or result in any odd side effects beyond what each vaccine brings anyway? I mean, they're not going to fight, right?
That is an absolutely wonderful question. I hope that they do not fight. The magical thing that we have as human beings on the planet Earth is that our immune systems are absolutely incredible. They have allowed us to survive hundreds of years of various infections. And what happens, we get exposed to a pathogen. Our body usually makes antibodies to it, and that means upon re-exposure, it either does not infect you at all, or you have minimal symptoms if you survive the first infection. Now, the low-hanging fruit, of course, is that people have never been exposed to it and they have comorbid health conditions, will not necessarily have good outcomes with that. But for what I like to say, regular people, the average person is walking around on the street, their susceptibility should not increase. The way the immune system works, it uniquely makes antibodies to a pathogen that it is exposed to. And that is when you have a vaccine, it gives you certain things for your immune system to look at, and it will respond to that. There are literally thousands of challenges on a daily basis to your immune system, to various pathogens. Viruses, bacteria such as streptococcus and staphylococcus, fungal infections such as yeast vaginitis, jock itch for men, toenail funguses, particularly with everybody wearing artificial nails. So your immune system is really, really just God's gift to why we are here, and it works wonderfully. So there's usually no crossover, no no negative impact from taking multiple vaccines at one time. And it seems to be able to sort them out wonderfully and give you the protection that each one is designated by each vaccine.
Thank you.
Mm-hmm.
I'd like to add to that. The key is, I'd like to add to that, Dr. Collier, thank you, is your immune system. Keep it at optimum, especially in this pandemic. Exercise, diet, nutrition, and rest, and exposing yourself to all sorts of viruses. 1 pound of dirt has got billions of viruses we're getting into our body every day. So that challenge is good, will keep us strong. And flu vaccine, the earlier question, is very helpful in preventing and maybe reducing the severity of COVID infection.
Got it. Thank you.
Any other questions from the media? Okay, I have a question. Dr. Blackmore, I know that the flu vaccine is being recommended for children starting as early as 6 months. Could you give some guidance to parents out there about getting their children vaccinated?
So you're talking about what parent, are you talking about children who are wanting to get vaccinated or children who can't get vaccinated?
Actually, you know what? I just realized that we have a pediatrician on the call, Dr.
Yeah,
Kirwan. So perhaps, Dr. Kirwan, you can take that question for me, please.
If you're just speaking in general, why or how pediatric patients should be vaccinated,
Yes.
basically come to CFCE or Jesse Trice or UHI, and we can vaccinate your children. If you have any specific concerns, you should speak about those with your pediatrician. Different patients have different, egg allergy, but we can work around egg allergy. HIV infection, you can still get a flu vaccine. Pregnancy, as mentioned earlier, we have teenagers that come, well, can I be vaccinated? I'm pregnant, yes. As one of the doctors mentioned earlier, there's very little contraindication to receiving a flu vaccine. If you've had a previous allergy, that might be a concern, or Guillain-Barré, that can be a concern. So there are specific things, and so you should address it with your pediatrician. But generally speaking, the majority of the population is able to safely receive a flu vaccine. I won't, go into the details that a lot of the other doctors covered, but basically visit your pediatrician, visit one of our health centers that are on this call, and we'll be happy to discuss it with you further. And there are a lot of myths out there that prevent parents from getting the flu vaccine for their children. I'll be talking about that next week, but there are a lot of myths that can be dispelled by your physician, your provider. So speak with them and be open to getting the flu vaccine, or at least having that discussion, because there's very little contraindication to a flu vaccine.
Fantastic. Thank you so much, Dr. Kirwan. And the webinar that Dr. Kirwan just mentioned is the webinar, Dispelling the Myths of the Flu Vaccine, that will be happening on Thursday the 10th at 12 p.m. And in addition to having education from Dr. Kirwan, we're also going to have a live performance by a neo-soul artist, so Joshua Jones. So we're combining a little bit of education and entertainment together to make it fun for the community. Any additional questions from the media? All right, fantastic. Well, that concludes our press conference. Thank you so much for joining us. Again, Live Healthy Miami Gardens is 100% committed to creating a healthy and active community here in the city of Miami Gardens. To find out more information about Live Healthy Miami Gardens, go to livehealthymiamigardens.com. And you may also specifically go to our influenza page to find out more information about the activities that will be offered through National Influenza Vaccination Week. Thank you. Be well.